chemical peels. Let's get right into it. Zeo 3-step peel, amazing product for this time of year, right? We are trying to get in there. We are trying to work that skin. We can peel 12 months a year if the patient is going to be compliant, meaning stay out of the sun during those peak hours, 11 to 3, wear sunscreen, but also reapply sunscreen, and just stay consistent with the regimen, right? We cannot peel someone on a Friday and then have you out on a boat for like 10 hours on a Saturday. You are not going to like the outcome. It's not going to work. It's going to be a waste of time. But 3-step peel and prepping for it. You can absolutely use a retinol pretty much like right up until the day of peel or the day before. Some patients will want to kind of go off of a retinol a couple days before. This is where skincare gets very specific, and this is why we like to treat every case individually. What is the outcome? How long has the patient been on skincare? How well is the skin preconditioned? What are we trying to accomplish? What's the state of the skin? Is the skin very healthy? Are we just starting off with a patient? They've only been on product for 4 weeks and then they want to have a peel. So it's going to be a little bit different for everybody. So the pre and post might differ, right? Especially the pre is going to differ for a lot of patients. Post care, we generally want to just be very kind to the skin. Things like gentle cleansers, we're going to lay off of a lot of heavy exfoliants, especially for the first 3 to 5 days. There are ways to kind of cheat through some of that peeling process once we get there if the skin is really well preconditioned. But again, it's going to come down to an individual basis every single time. So if you're thinking about it, 3-step peel would absolutely be something that I would do all the way through, pretty much right until June. And again, if you're a patient that's going to be super compliant and follow all of the rules, then we can peel you anytime that you want. It's just, we want to make sure that we set you up for success and also ourselves. We don't want patients to be unhappy with the outcome. And we want it to fit into your lifestyle. So prepping for the peel, we want to just stick with your regimen that you're doing. If we're looking to accelerate different things, we might have you use different products leading up to it. Because again, in the back of our minds, we know that if I have this patient using a retinol right up until, then that peel is probably going to penetrate a little bit deeper and we're going to get even a little bit more of an intense outcome based on what that might be. If we're looking to maybe kind of pull it back a little bit, maybe we have the patient come off the retinol 5-10 days prior, let the skin kind of settle a little bit. You're still using some actives, but nothing like a vitamin A, and then you're still going to get a great outcome. So the pre might be a little bit different. Post care, we're looking to hydrate. We are looking to not pick and peel at the skin, and we are looking for the skin to go through that natural kind of shedding process.